Mental illness in the workplace. Deciding to disclose information about non-obvious disabilities at work can be difficult and potentially risky, no matter what you do for a living. There are many disabilities that are more obvious than others. Some are immediately apparent, especially if someone relies on a wheelchair or cane. But others, known as invisible disabilities, are not. People who live with them face particular challenges in the workplace and in their communities. Employees often worry about what will happen if they disclose their illnesses to employers, due to the stigma attached to mental disorders. Those with mental illnesses are among the most commonly stigmatized. As a result, past research has suggested that employers don't want employees with these disorders. With the introduction of Americans with Disabilities Act, the workplace changed for all employees with mental illnesses. They are now able to ask and receive the accommodations they need. Nevertheless, this requires them to disclose their illnesses to their employer. This can be very difficult as many fear it will initiate negative, stigma-based reactions from coworkers and management. There are different ways people disclose this information to employers. Common reasons for disclosure: people in supported employment programs, former Social Security recipients, people in vocational programs, and those with visible disabilities. Workers likely to release information about their illnesses are those with the most noticeable or serious problems related to their illnesses. For example, diagnoses of psychotic disorders, which are prone to display increased symptoms at work. Several studies have also found evidence that disclosure to supervisors is more common than disclosure to coworkers. There have been several studies on the effects of these disclosures. However, many indicate both rewards and risks in relationships at work. Positive outcomes: emotional support from coworkers, more employment opportunities when disclosing you'll be accompanied by a job coach, supportive relationships with supervisors, more comfortable working environment, and receive accommodations needed. Negative outcomes: workers have reported to not receive job offers after disclosure, has appeared to link to premature job termination, cause tension between coworkers, and cause discrimination. Factitious disorders are mental disorders in which a person acts as if he or she has a physical or mental illness. People with these disorders deliberately create or exaggerate symptoms of an illness in several ways. They may lie or mimic symptoms, hurt themselves to bring on symptoms, or even alter diagnostic tests. The diagnostic criteria for factitious disorders, according to the DSM-5, are as follows: intentional production or feigning of physical or psychological signs or symptoms. The motivation for the behavior is to assume the sick role. Absent of external incentives for the behavior, such as economical gain, avoiding legal responsibility, or improving physical well-being, as in malingering. Many people with factitious disorders also suffer from another mental disorder, particularly personality disorders. People with personality disorders have long-standing patterns of thinking and acting that differ from what society considers normal or usual. Types: factitious disorder with psychological symptoms, factitious disorder with physical symptoms, and factitious disorder with both physical and psychological symptoms. Warning signs: dramatic but inconsistent medical history, unclear symptoms, predictable relapses following improvement, extensive knowledge of medical terms and textbook descriptions of illness, appearance of new or additional symptoms following negative test results, presence of symptoms only when patient is alone, willingness or eagerness to have medical tests, History of seeking treatment with many providers. Treatment: psychotherapy, including cognitive behavioral therapy, and medications to treat other illnesses like depression, anxiety, etc. If you or someone else has the signs of factitious disorder, please talk to your doctor or a medical professional. Also, stay stigma-free.